Good morning. Still, welcome to the Committee on Health and Human Services. Secretary, will you please call roll?
Assembly members Dahlia. Here. Edgeworth. Present. Gonzalez. Here. Goulding. Here. Gray. Here. Hathan. Hibbets. Here. Hunt. Here. Jackson. Koenig. Here. Nadeem. Wen. Here. Ortlicker. Here. And Chair Brown-May.
Here. Thank you very much. Please mark Assemblymember Jackson and others present when they arrive if they are not here. We do have members everywhere at this point. Thank you so much for joining us here in Carson City today, those of you in Las Vegas and anyone who is joining us online. Now that we are done with roll call, just a couple of housekeeping reminders. Please silence your electronic devices. If you wish to testify, please sign in at the table by the door and provide our secretaries with your business card. When testifying, remember to turn on and off your microphone. Clearly state and spell your name for the record. Members of the public may provide testimony on a bill either in person or by telephone. To do so, you will dial 888-475-4499, and today's meeting ID is 899-9035-7212, and press the pound sign. Our meeting agenda and committee information is available on Nellis, which can be accessed through the legislative website. You can also watch our meetings through our YouTube channel. Public comment today will be taken at the end of our meeting, and each person will be limited to 2 minutes. As a reminder, please, courtesy and respect is expected in all of our interactions, even when we do not agree with each other. As note that members will be using laptops, so please don't take that as a sign of disrespect. We do have 3 bills on our agenda today. So we're just at the outset going to limit public comment or testimony on each of those bills. 30 minutes in support, 30 minutes in opposition, 30 minutes in neutral as a way for us to be able to get through the agenda items and make sure everyone has a fair and equitable opportunity. We will locate 10 minutes in Carson City, 10 minutes in Las Vegas, 10 minutes on the phone line, and then come back around if we still have the 30 minutes, just so you know where we are. So I will cut you off, but probably gently at some point. Okay. With that, we will open our first bill hearing for Assembly Bill 483. We will welcome our member up, and you may begin when you are ready.
Thank you, Chair. Good morning. It's still morning. Yay. Good morning, Chair Brown-May and fellow committee members. I am Ewing Wing. I have the honor to represent Assembly District 8 in Southwest Las Vegas. Thank you so much for the opportunity here today to present Assembly Bill 483. I'm just a pretty face. All the experts are on my right. This bill comes from the Joint Interim Standing Committee on Health and Human Services and seek to prioritize the review of applications for healthcare professionals to ensure we are getting enough providers to our underserved areas. As we all know, our state is experiencing healthcare provider shortages, with those effects being amplified in underserved areas and negatively impacting the overall health and well-being of those residents. This bill is just one tool to address that problem by prioritizing the review of healthcare license applications for providers who have demonstrated that they will be primarily working in an underserved community. To help me present the bill and provide an overview of what AB 483 aims to address is the Chief Executive Officer of Community Health Alliance, Mr. Oscar Delgado.
Thank you. Good morning. Thank you, Assembly Member, and good morning to all of you. Again, my name is Oscar Delgado, OSCAR, CEO of Community Health Alliance. It's a pleasure to be here with all of you. Good morning, Chair May Brown and committee members. Community Health Alliance is a federally qualified health center, also known as an FQHC, with 6 sites located throughout Washoe County. We serve over 32,000 patients annually and provide comprehensive services, including primary medical care, dental care, behavioral health, a full-service pharmacies, and innovative food prescription programs throughout our pantries. As an FQHC, we operate under significant oversight from HRSA, and critically, we commit to serving all patients regardless of their ability to pay. This is based on a shared understanding that when people can access timely, affordable primary care, not only do they individually health outcomes improve, but also the entire community benefits. Preventing expensive emergency room visits and avoiding hospitalization is both physically responsible and morally sound. However, a major barrier to fulfilling this mission is the delay in licensing qualified medical providers, particularly those that are coming to our state from outside of the state and also newly graduated. The provider shortage in Nevada is real, and it is deeply felt in underserved communities like ours. We actively recruit and invest significant resources on onboarding new providers, sometimes spending tens of thousands of dollars in relocation expenses, credentialing, administrative onboarding, and training, only to have those providers sit idle, waiting months and months and months for a license to practice. These delays are not just frustrating, they're costly. Every week a provider cannot see patients is a week we lose critical revenue and patients go without care. When providers are weighing job offers, often from multiple states, the difference between an 8-week versus 8-month licensing timelines can be the deciding factor. Prioritizing the licensing of providers who are committed to serving in high-need communities is urgent. It ensures patients don't wait longer for access to care, and it supports the very communities that need the professionals the most. I am more than happy to take any questions from any of you. I understand all of you know the need in our community. This is just one tool that would help us close a gap here in our state throughout the entire nation. But to help me kind of paint that picture a little bit more, to my right here is our Chief Medical Officer, Dr. Travis Walker.
Thank you. I very much appreciate the opportunity to speak on this. And then for the record, my name is Dr. Travis Walker. To give some background, I'm a family physician by training. I'm a locally raised Nevadan and graduate of the University of Nevada School of Medicine when it was the only allopathic med school in the state. And I've had the opportunity to serve with Community Health Alliance now for 2 years. It's no secret we have a significant provider to patient shortage. We have one of the worst ratios in the country, and we may not be able to fill that gap in your or my lifetime with our current infrastructure for medical schooling, physician assistant studies, or nurse practitioner studies. The bottleneck with residencies is also real. So attracting out-of-state talent is key for our workforce development. And this bill would absolutely help, and especially triage that out-of-state talent to key needed areas like the underserved and rural communities. I did want to provide a story that we've dealt with professionally at Community Health Alliance. So we've encountered this problem where we have had even locally grown talent who've had to seek training outside of our state. In particular, we had an MA who worked tirelessly to become a physician. She ended up entering into an internal medicine residency in New Jersey. And upon graduation, her 2 children, and her husband, who had relocated to New Jersey, had the opportunity to return to Nevada. And had it not been for her strong ties to Nevada and her persistence in moving back to this state, I fear that she may not have returned. Because her licensing took 10 months, as opposed to New Jersey, which had approved her license in 1. She would be one of those physicians who would have benefited from this priority, and that would have been 9 months of care that could have been provided to patients. Hundreds of patients could have been seen in that amount of time. But my other fear is that for providers who come or attempt to come to Nevada and want to do good work and serve the underserved and serve in rural capacities, that they may be pushed to other states. They may not find that this process is enough to stick with. And my concern would be that there would be valuable talent lost to other states that have a more efficient and streamlined and predictable licensing process. While it may not necessarily affect us, it would have a profound impact for the rest of the state. And for when those moments come that we are in a position to need to hire out-of-state talent, this bill would be a huge support to us in the state. And I welcome any questions as well.
Thank you, Doctor. Chair, if I may, I can walk through the section of AB 483 for the committee. Thank you. Section 1 provides the definition of historically underserved community and outline the scope of where this bill will have an impact. This definition includes a qualified census tract as designated by the Secretary of Housing and Urban Development. This includes census tract in which 50% or more of the household have an income less than 60% of the area gross median income, or an area with a poverty rate of at least 25%, and a census tract in which at least 20% of households were not proficient in English or qualify tribal land. I would note that this definition is specific to the licensure of emergency medical services. The definition is further expanded for the other healthcare professional in Section 5 to include public school in which 75% or more of enrolled pupils are eligible for free or reduced price lunches of public school, or public school that participate in universal meal services in high poverty area. The remainder of the bill require healthcare licensing board or agencies to adopt regulation that establish a process for prioritizing the review of an application if that applicant demonstrate they will primarily serve in a historically underserved community. And Chair, that is the end of our presentation. We are now ready for questions.
Thank you for your presentation. Members, any questions? I do have one. You're not getting off the hook that easy. First, I'm going to say thank you so much for carrying this measure on behalf of the interim committee. It's really great to see you all here today, so thank you for that. There is a process for prioritizing the review noted on page 5. I'm curious to know, is there a recommended process that is being considered or that you are recommending as part of this? And I understand it's not the language in the bill, but I'm curious to know, is there a process that we can lean on?
Madam Chair, Oscar Delgado for the record. There is, and we're looking forward to working with staff. Of course, we don't want to reinvent the wheel. Other states are doing an amazing job on prioritizing providers that are working in at-risk communities. And so we're happy to work with any of the state staff to find those efficiencies and also work with the Nevada PCA in terms of how we can mirror without, again, reinventing the wheel, but just trying to find opportunities to really incentivize and prioritize providers that want to work in these communities.
Thank you for that. I appreciate the answer. And then second question from me is that this talks about emergency services or EMS, right? Specifically, is that the only type of doctor that we're looking at, or is this a broader licensing process?
It's broader. Of course, at Community Health Alliance, we don't provide the emergency medical providers that type of service, but for us specifically, it's a broader context in which we would be part of the primary care piece of it.
Thank you for that
Oscar Delgado for the record, sorry.
Thank you for that clarification. I appreciate that. We have a question from Assemblymember Goulding.
Thank you, Chair. To follow up on that, so if you qualify because you're going to provide healthcare services to an underserved community, you jump to the top of the list. Is that right? Do you have? Sorry. Yeah, that looked like a nod and affirmation. Do you have any sense of what that will do to the timeline? And to tag on to the other question, should we be really looking at redoing a process instead of just jumping? Because if the process is still too long, it sounds like maybe we have to address a bigger issue that the next interim committee will have the opportunity to work on.
Thank you for the question, Assemblymember Goulding, Ewing. For the record, I think we are doing this as an enabling language, so that in regulations, when we are, if this pass, when we go into regulations, we will work with staff, like Mr. Delgado said, to put this as a priority item. So I think the timeline now, whatever it is, we need to look at this as a additional step. So if these language stays the way it is, and the application process would have those steps of saying you need to have these the zip code that you're serving when you're applying for the licensing, if that's in there, or even like a job offer from a community organization like an FQHC, or even support letters from multiple nonprofits in that area where that provider will be in. Those will be part of the application process so that it will help speed up the application. So I think as we move through the process, we will identify touch point that will put those application on top so that when it goes to the boards for the licensing piece, it will be on the priority pile versus just on a regular processing pile, depending on the time that it was submitted.
I guess I didn't ask the question very well. So one part of it is by putting somebody on the top of the list. So I appreciate the information about like how you would qualify to be at the top of the list, but by being on the top of that list, is there an estimate of how effective this will be at getting the licenses processed more quickly? And then the process part of my question was really, I think this is an indication that we have the process for everybody needs to be addressed, because even if we're giving priority to this group that's addressing a special population, we should be addressing the issue as a whole in the state. If it's taking a month in another state, regardless of who you're serving, let's streamline this process. So I guess the question is that the intent? So one is how effective will this be at speeding up the process? And two, is the intent to cleaning up the process across all applications?
Mr. Delgado, I'm going to jump in for you first, though, just to clarify for Assemblymember Goulding, and I appreciate the question sincerely. So we, during the interim, had conversations with the Nevada Licensing Board, and as they review their process. And so there is a lot of work that's being done with that regard, just so that you are already aware of the good work that's being done within the state currently to work on the expediting licensure in totality. For this underserved population, though, that's where this bill came from. So, Mr. Delgado, if you feel free to answer.
Yeah, and I think, Chair, through you, Oscar Delgado for the record, Assemblymember Golding, absolutely, that is exactly correct. I think there's opportunities to find efficiencies through all the different boards that we have to work through. We know that time is of the essence in the immediate in terms of us recruiting in the immediate. Just for example, the 42 providers that we have at Community Health Alliance, from MDs, DOs, APRNs, and PAs, of the 10 of those had waited for more than 150 days to get licensed. Of the 5 of those 10 waited for over 250 days. And so any opportunities where we can find efficiencies in the immediate and also work with all of you in the long term, we are definitely open to those opportunities. But as we all know, the gaps are wide and growing, and we want to try and find a way to attack while we have the opportunity. And again, always working to see how we can work with the licensing board and also with the committee in the immediate.
Thank you for that detail. It was very valuable. Members, any other questions? No? Okay, seeing none, thank you for your presentation. We'll ask you to step back at this time, and we will open up testimony in support of Assembly Bill 483. If you are here in support of this measure, please come forward here in Carson City and in Las Vegas. Thank you. Please state and spell your name for the record, and you may begin. You'll have 2 minutes. And as a reminder, we're going to go round robin 30, 30, 30. Yes. Thank you. Go ahead.
Good afternoon, Chair Brown, May, and members of the committee. I'm Nancy Bowen, Nancybowen, CEO of the Nevada Primary Care Association, representing the state's community health centers. Our members are required to locate in underserved areas, and 88% of health center patients have incomes below 200% of the federal poverty level. Health centers have a unique model of integrated services in primary care space. Many sites offer medical, dental, behavioral, and enabling services under one roof. This model requires a diverse team of licensed health professionals. For example, our members employ 52 nurse practitioners, 51 nurses, 31 physician assistants, 38 physicians, 65 pharmacy staff, 9 dentists, 7 dental hygienists, and 9 licensed mental health providers. AB 483 is an effective way to lower costs for our health centers serving the most vulnerable Nevadans. NVPCA regularly hears how much burden it can be for a health center to recruit and employ a provider over some period when they are not licensed in the state and cannot provide services or earn revenue. Prioritizing these low-margin clinics makes sense to ensure all access to all communities in our state, and for this reason, we support the bill.
Good morning, Chair and members of the committee. For the record, my name is Annette Magnus, and I am here today for my client, the Asian Community Development Council, to support AB 483. We serve the AANHPI community across Nevada, and we know that the AANHPI community are often overlooked as an underserved community. We appreciate the intent of this bill, especially to prioritize language access for our populations that we serve. Thank you for hearing this important legislation, and we urge your support. Thank you.
Hello, committee. Good, is it almost noon? Good morning, something like that. My name is Devin Ashoff, DEVENASCHOFF, up here on behalf of Toro University, Nevada. Just wanted to say that we support AB 483, and we wanted to thank Vice Chair for presenting this and the sponsors for bringing it forward. Thank you for your time.
Thank you. Seeing no one else here in support in Carson City and no one at the table in Las Vegas, ABH, is there anyone on the telephone line in support of Assembly Bill 483?
If you would like to testify in support of Assembly Bill 483, please press star 9 or raise hand in your Zoom window now to take your place in the queue. Again, if you would like to testify in support of Assembly Bill 483, please press star 9 now. Caller with the last 3 digits, 000, please press star 6 to unmute your phone. Caller with the last 3 digits, 000, please press star 6 to unmute yourself. Chair, it appears this caller is having some trouble unmuting. Would you like me to move on?
Yes, thank you, ABH.
Chair, there are no other callers wishing to testify in support at this time.
Thank you. If that caller is wishing to offer support, we will also take that electronically. You're welcome to submit your comments in writing, and then we'll come back to you again, hopefully, for another opportunity. At this time, we'll move into opposition testimony. If there is anyone here in opposition of Assembly Bill 483, please come forward at this time in Carson City and in Las Vegas. Seeing no movement in either location, AVH, is there anyone on the telephone line who would like to offer testimony in opposition of Assembly Bill 483?
If you would like to testify in opposition to Assembly Bill 483, please press star 9 or raise hand in your Zoom window now to take your place in the queue. Again, if you would like to testify in opposition to Assembly Bill 483, please press star 9 or raise hand now. Chair, there are no callers wishing to testify in opposition at this time.
Thank you, AVH. At this time, we'll move into neutral testimony. If you would like to offer testimony in neutral on Assembly Bill 483, please come forward at this time in Carson City and in Las Vegas. I see movement, but not toward the table. AVH, is there anyone on the telephone line who would like to offer testimony in neutral on Assembly Bill 483?
If you would like to testify in neutral for Assembly Bill 483, please press star 9 or raise hand in your Zoom window now to take your place in the queue. Again, if you would like to testify neutral for Assembly Bill 483, please press star 9 or raise hand in your Zoom window now. Chair, there are no callers wishing to testify in neutral at this time.
Thank you, AVH. Thank you. Thank you. AVH, do you want to try one more time? Is there anyone in support of this measure on the telephone line, given that there was difficulty unmuting previous, please?
Yes, Chair. If you would like to testify in support for Assembly Bill 483, please press star 9 now to take your place in the queue. Again, if you would like to testify in support for Assembly Bill 483, please press star 9 now. Chair, there are no callers wishing to testify in support at this time.
Thank you, AVH. At this time, we will call the bill sponsor back to the table, please. I think we have a question from a member before we close this bill hearing. Assemblymember Hafen, would you like to ask your question?
Yes, Chair, clearly I'm having trouble unmuting myself too. And I apologize, I didn't get the question up. I'm just looking at the definition of historically underserved community. And specifically, I'm just trying to understand it because it almost looks like some of the rural areas that desperately need some of these services would not qualify under the definition. And so I don't know if that was the intent. I didn't sit on the interim committee, so I was just hoping for some clarification on the definition under Section 1 of historically underserved communities.
Madam Chair, through you to Assemblymember Hafen, Oscar Delgado for the record. That is definitely not the intent. The intent is to include anyone that would otherwise qualify. The HUD definition is usually really pretty broad, and all rural census tracts usually fall within that designation as underserved.
Ewing Wing for the record, and Assemblymember Hafen, if you would like for us to expand that, if the rural areas that you're referring to, perhaps, the district that you represent is not able to be qualified in this, we would love to work with you on making sure that we're not leaving them out. The whole point of this is to serve, and I know that these are terms that used by a federal qualified health center is called medically underserved area or medically underserved populations, and those are interchangeable when it comes to also redefining some of these historically underserved community as well. So I would love to work with you to make sure that we don't leave the folks who are truly needed out of this conversation. So thank you for bringing that up.
Thank you, and thank you, Chair. I'll bring the rest of my questions offline to the bill sponsor. Thank you.
Thank you. I appreciate the question. I do believe that we may have a recommendation or further clarification from our legal staff. Please go ahead.
Thank you, Chair. David Noss, LCB Legal for the record. Just to provide the definition that is referenced in Section 1 and Section 5, the federal reference is 26 USC 42D 5B2. And when you go to that, it states a qualified census tract means a census tract designated by the Secretary of Housing and Urban Development for the most recent year for which census data is available, either in which 50% or more of the households have an income which is less than 60% of the area median gross income for such year, or which the poverty rate is at least 25%. Thank you.
Thank you very much. Is that helpful? Assemblymember Hafen, thank you. Okay, with that, we will close the bill hearing for Assembly Bill 483. Thank you so much. Next on our agenda, we will open the bill hearing for Assembly Bill 297, and we will welcome our member to the table. Please take your time. You are welcome to begin whenever you are ready.
Good morning, Chair Brown May, Vice Chair Wynn, and fellow committee members. I am Hanadi Nadeem, and it is my honor to represent Assembly District 34 in Las Vegas. Chair with me today, there are two other presenters of this bill, Assembly Member Cecilia Gonzalez and Aisha Goins. I also have Administrator for Nevada Medicaid, Stacy Weeks, and Vicky Ives, who is the Health Service Bureau Chief, to answer questions related to Medicaid coverage or the home visiting program. AB 297 seeks to improve maternity and infant care in Nevada. Before I begin, I have a proposed amendment that is available on NALIS and will be the focus of my presentation today. I would like to provide a bit of background information to help give you content on the problem we face. Currently, Nevada ranks 43rd in the nation in adequate prenatal care. Maternal and infant mortality rates are high, with racial disparities reflecting much higher rates in Black and Indigenous birthing parents have a 46% higher rate of severe complications during delivery. The Nevada Home Visiting Program currently serves pregnant and birthing parents with children up to the age of 5. It serves approximately 500 families and is funded by a grant. This amendment would allow home visiting providers to enroll as Medicaid providers and receive reimbursement for their services. This is a crucial component of a long-term, more sustainable funding model. The goal of my proposed amendments are twofold. Number one is to improve access to evidence-based care in the home setting of pregnant birthing parents and infants in Nevada. Secondly, the amendment will help the state achieve these goals by expanding access to home visiting services statewide to pregnant birthing parents and infants through new Medicaid reimbursement for these important services. If passed, Nevada will join other 28 states that cover these services. The reimbursement rate is consistent with the model used in other states, which pays per visit and includes an incentive add-on payment for home visiting providers that render services in rural communities. The services will be covered as a preventive services in Medicaid, designed to mitigate high-risk pregnancies and births and improve overall outcome for pregnant parents and infants. With the chair, with your permission, I would like to invite my co-sponsor, Assembly Member Cecilia Gonzalez, to please share her thoughts and ideas.
Thank you so much, Chair and committee members, and thank you so much, Assemblymember Nadeem, for allowing me to share my story of why this bill is so important. When I gave birth to my daughter last year, I had the privilege of having a very supportive partner who quit his job to stay home with us. We made this decision because we knew how critical those first weeks were for my healing, for breastfeeding, and for bonding with our daughter. But I know so many mothers don't have this kind of support. This is especially true for mothers on Medicaid who often face barriers to accessing the care and services that they need during the postpartum period. As a Thai and Mexican American woman, I am especially aware of the unique challenges faced by Asian and Latina mothers. Studies show that both Asian and Latino mothers face significant disparities in maternal health outcomes, largely due to systematic barriers like language, lack of cultural competent care, and stigmas around mental health, particularly postpartum depression. Research indicates that Latina mothers, especially those in immigrant communities, face higher rates of maternal morbidity and mortality, but are less likely to receive adequate postpartum care. According to the CDC, Latina women often face significant gaps in postpartum follow-up care due to logistical challenges, cultural barriers, and a lack of support in their communities. Asian mothers, particularly Southeast Asian mothers, also experience a similar lack of support and face higher rates of postpartum depression, yet they are less likely to seek care due to language and cultural barriers. And I also just wanted to address some of the emails and concerns that we've been getting. I know that my email has been blown up over the last week about this bill. It is not mandating care for all mothers. It's about providing an option for mothers who need it the most, again, particularly those from underserved communities. For mothers who are navigating cultural and language barriers, the opportunity for a registered nurse to check in with them after childbirth is invaluable. tool. Like my co-presenter and sponsor have mentioned, there are already existing programs. I, as a resident of Clark County, based on my zip code, did have someone from Clark County come in and check on me during that period. I will say at first I was kind of like thrown off, but thinking to many things and all the challenges that we face as new mothers, it's very exciting to have a nurse come and speak. Again, this bill creates an opt-in opportunity for mothers to receive care that they may not otherwise have access to, that could prevent long-term health issues both for the mother and her child. For mothers who feel isolated, unsupported, or overwhelmed, a nurse check-in could be the connection that they need and the support that maybe wasn't available. As a legislator, I've always worked on policies to champion supporting families, and this bill is exactly that. It's an opportunity to give mothers, especially those on Medicaid, or those on Medicaid, shall I say, a chance for the care and support that they deserve. It's about dignity, it's about care, and it's about making sure that no mother, regardless of her background, has to recover alone. And so thank you so much for allowing me to share my story as a brand new mom, as many of you know. Thank you.
Good morning. My name is Aisha Goins, AESHA-GOINS. Thank you, Chair, and thank you, Committee. And I'm here to first talk about the doula bill that was presented. This was 2 sessions ago. This bill will expand on what has already been created. So in the doula bill, when it was created with Assemblymember Chandra Armstrong Summers, the intent was that those parents would have postnatal care for 3 visits and they would be reimbursed through Medicaid. And so this is going to be an extension of that. And one of the other things I want, and I very rarely get the opportunity to tell my own story, but I am an adoptive mother of a child who I had from birth. And directly after that, my son was a NICU child. And he came home 2 weeks after that to me. And just like Assemblymember Gonzalez said, somebody showed up at my door, and I also was thrown aback. But it was a nurse to help me facilitate the issues and the dynamics of having a young infant child that was born premature, and the care that was necessary to teach him how to eat and how to swallow, because these were the issues that I had with having a baby that was born prior to his time. One of the other things that I didn't know is I didn't know how to change a diaper. I know this seems like, you're a mom, you should know how to change a diaper, but he was so small, I couldn't figure out how to get this diaper on him to make it collapse and make it fit. And so the nurse was able to help me just facilitate those things that helped me establish myself as a mother. And now my son is 21. Thank God he don't need diapers. But because of this service, it allowed me to settle as a new mother and as an adoptive mother to a child that I received out of NICU. So this is so important that we're able to move this care forward and extend it up to 24 months because, after a certain time, they stopped showing up. I didn't know what to do. But to be able to have access to someone that just helps you get through that, to me, was invaluable. Thank you.
Thank you so much, Chair. Thank you, the presenters. And with that, Chair, we are open for the questions.
Thank you for your presentation. Thank you. We do have a question from Assemblymember Goulding.
Thank you, Chair. I know that you covered this, but I think that it is important to reiterate, because I imagine that all of our emails have been blown up, our inboxes have blown up with emails about this. There's nothing in this bill that requires a mother to have these visits, as I understand it. Am I correct?
Aisha Goins, for the record, you are correct. This is something they would opt into, yes.
How would a mother opt into it?
So when a mother there are professionals here that can answer this question. Maybe it's time for them to bring them up. But the way Aisha Goins, for the record. One moment, please.
Good morning. Stacy Weeks for the record, Nevada Medicaid. So typically when we have someone covered in Medicaid, the case management, which is under managed care, will notify them that this benefit is available. And if the individual says, no, I'm not interested, then the home visiting would not come out. There is a current program. I'm happy to have DBPH come up and talk about how that would work. But this is about the Medicaid coverage, and the Medicaid coverage system would just be connecting them like we do for any service.
Thank you for confirming that it's only if the mother wants this service that they would have somebody visiting their home. Thank you.
Thank you. Next question from Assemblymember Edgeworth.
Hi, thank you for bringing the bill. I think improved outcomes in maternity and newborns, that's a really important topic. You mentioned that it's been implemented in 28 states. Do you by any chance have data to support data that shows that this intervention has statistically improved outcomes or decreased hospitalizations or decreased depression or any kind of data like that? Is that available?
Chair, committee member Stacy Weeks for the record. There is a lot of data on home visiting programs. That's why they are federally recommended and funded as a grant program right now. We have Vicki Ives here from DBPH. If she could come up and actually speak to all of the wonderful outcomes that these programs have had for moms and babies and who are in poverty.
Thank you for being here. We welcome her to the table.
Thank you, Vicki Ives for the record, VickieIves with the Division of Public and Behavioral Health. Thank you for the question. In terms of outcome data, we have data both on our state program, which is supported by the Maternal Infant Early Childhood Award, for the state, as well as there's national data as well on outcomes, as well as return on investment studies by entities such as the RAND Corporation. Return on investments show anywhere from $1.87 to up to $6 return on investment for McVie model home visiting evidence-based programs. And then there's state data that tracks a whole variety of different benchmarks around, preterm birth, safe sleep, perinatal depression screening rates. And we look at those across both national data, state data for those not currently enrolled in a McVie program, as well to benchmark our progress. And we do see improvements looking just at that state level over state and national data on numerous benchmarks. Not every single one, but numerous, if that's helpful.
Thank you, that's helpful. Is it possible for you to, I don't need all of the data, that's a lot of data it sounds like, but is it possible for you to bullet, I don't know, maybe 5 improvement, 5 things that were improved nationally or with Nevada? That would be really helpful. Thank you.
Thank you, Vicki Ives, for the record. In terms of Nevada data, some highlights on these are these evidence-based McVie funded models. Some of our outcomes, just a few to highlight, where we.
I apologize. If this would be easier to send me or send to the committee later, that would be okay too. I didn't expect you to have every single data point in front of you.
Thank you. I'm happy to share that with you. But if a few are of interest, with developmental screenings, for example, it's consistently higher among our McVie served families. 58% compared to a national rate of 35.6%, and statewide 23.8%. So that's a much higher rate with our McVie families in recent data. School readiness is in the 70% range, which is higher than we see for state. Preventive dental visits is another area. Safe sleeping practices to prevent infant mortality is at 94% in the data, which exceeds national and state averages, just as a sampling. We don't always exceed some just because of who we serve, who we have to serve per the federal guidelines, as priority populations might be dealing with more barriers and stressors or late entry to care. So something like preterm birth we've seen actually can be higher in our population, even though that's an area where we actively serve to reduce, if that's helpful context.
Thank you.
Thank you. Members, any other questions? Okay, seeing none, thank you so much for your presentation. We'll ask you to step back from the table. At this time, we'll open up testimony in support of Assembly Bill 297. If you are here in support of this measure, please come forward here in Carson City or in Las Vegas. Thank you. Go ahead, spell your name. You can begin when you're ready.
Okay. Hello, Chair Brown May and members of the Assembly HHS Committee. My name is Carissa Pierce, CARISSA, and I'm the Government Affairs Manager with Children's Advocacy Alliance. CAA is an independent voice for Nevada's children with a mission to ensure that every child in Nevada thrives. And we are in strong support of AB 297 to expand home visiting services for Nevadans with Medicaid, with the amendment, of course. Home visiting is supportive to new families to navigate the challenges of pregnancy and then bringing a new infant home. Home visiting supports families with connecting to services such as mental health services, housing assistance, and nutrition programs. And for our Medicaid population, many of these folks are eligible for additional programs, but they may not know about the programs or may not know that they are eligible. So having a trained professional visit with the families and provide those resources helps to improve stability and reduce stress of building and growing your family. Home visiting provides support during pregnancy to help new parents feel prepared for bringing their infant home and provides support to the postpartum period as well, including breastfeeding assistance and education on safe sleep practices and promoting early learning and increasing the family's economic self-efficacy. We are optimistic that the provisions outlined in AB 297 will serve as a stepping stone toward making these services universally available to all eligible families, regardless of their insurance type. And we want to thank the Assembly member for bringing this forward and for the opportunity to provide testimony.
Good afternoon, Chair and members of the committee. My name is Davida Tyson, DAVIDA. TYSON with Pinion Public Affairs, and I'm representing the Nevada Women's Lobby. The postpartum period is critical for both parents and newborns, involving significant physical and emotional adjustments. Home visits can provide support during this phase through parent education, early development screenings, and guidance. AB 297 will assist families in creating nurturing environments with a strong foundation for lifelong learning and health. The Nevada Women's Lobby believes that AB 297 represents a proactive and compassionate approach to maternal and child health care. By facilitating regular postnatal visits by registered nurses, we can improve health outcomes, offer essential support to new mothers, and contribute to the overall well-being of Nevada families. Thank you.
Thank you. Seeing no one else here at the table in Carson City, we'll go down to Las Vegas. You may begin.
Good afternoon, and thank you, Chair Brown May and the committee. My name is Jolina Walker, JOLLINA WALKER. I am an international board certified lactation consultant and doula, and I am here in strong support of AB 297. I am not being hyperbolic when I say that a home visiting nurse saved me and my baby's life 24 years ago in May. I was sent home after a postpartum hemorrhage, unable to effectively breastfeed, sitting on a blow-up pillow in my bedroom in tears when a home visiting nurse showed up at my door. She provided me with the understanding of what I needed to take care of myself, my body, and my baby. She gave me referrals to lactation consultants and pediatricians that I did not have access to before. When I say that she saved my life, she saved my mental health, and she saved my relationship with my baby and that lactation journey. Fast forward that, some 15 years, I am a doula and an IBCLC, and I sit bedside for prenatal and postpartum patients very often. And the way that we are able to support our community by providing resources, by providing reassurance, by literally connecting with these mamas in these solitary rooms where they feel so alone and without resources, AB 297 can help affect families, generations, so that we can have healthy mamas and healthy babies, and we can provide them with all of the resources, love, and care that every new parent needs coming home from the hospital. I truly hope that you will support AB 297. Thank you.
Thank you for your comments. Seeing no one else in Las Vegas wishing to provide testimony and support AVH, is there anyone on the telephone line wishing to offer testimony in support of Assembly Bill 297?
If you would like to testify in support of Assembly Bill 297, please press star 9 or raise hand in your Zoom window now to take your place in the queue. Again, if you would like to testify in support of Assembly Bill 297, please press star 9 or raise hand in your Zoom window now. Follow with the last 3 digits, 000. Please press star 6 to unmute your phone. You may begin. Caller, are you unmuted on our end? We are unable to hear you. Caller, you are unmuted and may begin. Chair, it appears this caller is having difficulty unmuting again. Would you like me to move forward?
Thank you, AVH. Yes, please.
Hello, my name is Sausan Al-Rashidi, SAWSANALRSHAIDEH. As a mother and postgraduate student in public health with a focus of maternal and child health, I express my strong support for AB 297. This bill represents a vital step towards improving the health and care for mothers and children in Nevada. Thank you.
Hi, my name is Melissa Bartplange, BART-PLANGE, and I am in strong support of AB 297. I am a mom of 2 kiddos, with one being a medically complex little guy, and he was in the NICU for about 3 months, and when we brought him home, he had a G-tube. And I just wish a service like this was available for parents like me who had 11 doctor's appointments that we had to see within 1 month with various specialists. And my mental wasn't the best with trying to take care of a newborn child with special needs. And we didn't have the support from anyone, really. We had to figure things out all on our own as far as like the G-tube and what we do when we get home. So I think just having a nurse come in to help parents who are already in a fragile state with having a medically complex child would be very helpful. And thank you for your time.
Good afternoon. My name is Renee, R-E-N-E-E, Ruiz, R-U-I-Z. I am with National Nurses United, National Nurses Organizing Committee, and we represent the interest of 3,000 plus RNs throughout the state of Nevada. We proudly stand in support for AB 297. We believe that this bill, and as it becomes law, would help to further create healthy communities in the state of Nevada, create healthy relationships between mother and child, and all around do wonders in creating a safe space for our citizens of Nevada. Thank you very much.
Caller, you're unmuted and may begin.
Hi, my name is Anam Kadir, ANAM, last name QADIR. I'm from Henderson, Nevada, and I want to express my strong support for AB 297. This bill is critical in preventing maternal mortality through mental health screening, encouraging positive parenting, and identifying developmental delays early in children. Given that Nevada does rank 43rd in adequate prenatal care, it's clear that action is needed. AB 297 will make a meaningful difference for families like mine. Thank you.
Hi, my name is Saman Tariq, spelled as SAMANTARIQ. I am one of the primary care physicians with University Medical Centers of Southern Nevada and Las Vegas. I strongly support this bill, AB 297, on establishing postpartum home care services for new mothers, similar to programs available in European countries. As a physician and as a mother who experienced this model firsthand, I firmly believe this is an initiative have a profound impact on maternal and fetal health across the state. When my child was born in Ireland, I received daily home visits from qualified nurses in the days following delivery, and that really helped me improving my physical health and mental well-being as well. And also, it was really helpful supporting with the breastfeeding, emotional check-ins, and guidance on newborn care. So I think that the benefits of postpartum home visits are well documented. Countries that offer such services have seen significant reduction in both maternal and infant mortality and morbidity. Early intervention can detect postpartum depression, prevent complications like infections or feeding issues, and improve long-term outcomes for families. Furthermore, this model reduces unnecessary emergency room visits and hospital readmissions. By bringing this level of care to our communities, we can ensure that all our mothers, regardless of socioeconomic status, have access to vital support during one of the most vulnerable times in their lives. I urge to support this important legislation and help us take a meaningful step towards improving maternal and fetal health in our state. Thank you so much for your leadership and services.
Good afternoon. My name is Saida Bibi, Saida Bibi. I was formerly a chemist at Novartis Pharmaceuticals. I highly support Assembly Bill 297 because as a mother of 3, born all by C-section, I have experienced the postpartum depression that often follows childbirth. And while I was lucky to be provided a base of support and care, there are others who unfortunately were unable to do so. According to Mayo Clinic, more than 60% of pregnancy-related deaths are preventable. 40% of women do not have a doctor's appointment after giving birth, and 33.1% of pregnancy-related deaths occur between a week and a year after delivery. This number can be significantly reduced with visitation from healthcare professionals. Every new mother faces postpartum depression to a certain degree after childbirth. And as a survivor of that myself, I can say that it was very difficult to recover physically and mentally while providing for my 3 kids. AB 297 guarantees that the new mothers and children in Nevada will be supported during one of the most difficult stages in a mother's life to ensure that our population can continue to grow and live. Therefore, I support AB 297, and I thank the community to giving me the opportunity to voice my remarks. Thank you so much.
Hi, my name is Faiza Kadir, FAIZAQADEER. I am reaching here to share my full support of AB 297. We can help prevent maternal death, reduce the risk of child abuse and neglection in postpartum depression.
Hello, my name is Robin Franklin, and I am a member of SEIU as well as an advisor for the National Action Network. And I wanted to say thank you, one, for allowing me to speak at today's committee. And I am definitely in support of AB 297. I say this because I am a mother who had a traumatic birthing experience. And then thereafter, I had even a more traumatic postpartum, having issues with my incisions because I had a C-section. And unlike everybody else who said that they had a nurse to come by, I didn't have a nurse. I was left with going to the emergency room, going to the quick cares to find out what was going on with me. I can't tell you what a benefit it would have been to have somebody there to walk me through what I was going through, what I was feeling. I know that I was struggling with lactation. I didn't have anybody to speak to about that. And it took me a while to get to the doctor. So I believe that this bill would only benefit our community. I'm in support of it. I believe that we can help our lower income community. As a Black woman, as a woman who knows that postpartum exists, that maternal mortality exists, that it is higher in my population, that I would love to see us be able to provide those mothers with that care and the infants with that care. Also, as a child welfare worker and a warrior for the last almost 20 years, we regularly send women, our mothers, to have nurses available to them. So I know that it's a benefit. So I thank you for your time, and I am in support of AB 297, and I hope that we get this passed. Thank you.
Good afternoon. My name is Javaria, Javaria, and respected Chair and Vice Chair and Honorable Committee members, I'm calling to voice my wholehearted support for Assembly Bill 297 as a community member and, more importantly, a mother who has walked this path herself. AB 297 for me isn't just another healthcare measure. It's a lifeline for mothers and families that wish to opt into it in one of the most delicate and defining moments of their lives. Welcoming a new baby is always a time of joy. However, for many parents, it does come with uncertainty, exhaustion, and silent struggles. Even a single well-timed visit from a trained professional can be the difference between a family spiraling into crisis or finding their footing in their new journey in life with confidence and care. So this bill recognizes something deeply human, that support in the early days matters. It matters for maternal health, it matters for infant safety, and it matters for emotional well-being. So from addressing postpartum depression to helping parents understand newborn needs, AB 297 ensures that mothers who opt for it are not left to navigate those crucial first weeks alone. So this isn't just a bill about home visiting. It's about compassion and empathy backed by statistics and research. Evidence also shows that when we invest in early interventions like this, we prevent larger, costlier issues down the line, as healthier families lead to stronger communities, and that's the long-term return. So I would want to offer my support for AB 297 to give these families the strong start they deserve. Thank you very much for listening.
Or with the last three digits, 655. Please press *6 to unmute your phone. You may begin.
This is Dr. Mayra Parveen, spelled as Naiyera. Parveen, Parween. I am a practicing physician in Henderson, Nevada. My office is in an urban setting, and I am a big advocate for the good prenatal and postnatal care. As I always encounter many complications postpartum patients coming to my office, having hemorrhage and infection and other things. So I'm a big advocate for AB 297. And it's a big step forward and much needed help for the Nevadans in lowering infant maternal mortality and morbidity. Statistically, 35% of maternal death occurs in first 42 days of postpartum period. 75% of these deaths happens from pregnancy and postpartum complications. Most important of that is mental health. Postpartum psychosis, postpartum depression, and suicidal ideas are not uncommon. And we always encounter these kind of patients in my office. Also, complications arising from anemia, hemorrhage, infection,
These are very common and preventable as well as treatable if detected early on. Medical conditions induced during pregnancy, such as pregnancy-induced hypertension, gestational diabetes. These are the conditions which needs to be followed on properly, postpartumly. Patient intervene on timely basis is the key factor. New mom also suffers from various other barriers which hinders their access to medical care, which includes their care for infants, newborn babies, sleep deprivation from it, breastfeeding. They need assurance regarding the breastfeeding, and also postnatal visits. Sometimes hard for them to come themselves to the office with all these problems, especially if they don't have social support system. And it has been proven that other states who have postnatal visits, they are doing very well and preventing and lowering the ER visits for the infant and mothers. Home visiting service is a standard practice.
Thank you, Doctor.
in
If you
European
wouldn't mind
countries.
wrapping your comments, you've reached your 2 minutes at this point, and we're happy to receive your comments in writing if you'd prefer.
Okay, thank you.
Hello, my name is Dr. Nasreen Majid, Nasreen, Majid, Majid. I'm a pediatrician in Las Vegas, practicing for about almost 20 years. So I'm in favor of AB 297 because it will really improve the maternal and infant health. As a pediatrician, I see a lot of infants are suffering feeding difficulties, especially breastfeeding and problem sleeping. So the parents are already overwhelmed with a new baby. So home health nurse visit will really help improve the feeding and advising the infant care. And also mothers are also suffering some postpartum depression, high blood pressure, and anemia from excessive blood loss and infection. So home health visit will really improve this thing. It will decrease the readmission of the moms and the baby's admission to the NICU. So I would really encourage you to have a AB 297. It will improve the infant and mom's mortality. And thank you.
Hi, my name is Sadia Tarar, SadiaTarar. I am for AB 297, and this bill will help protect children by promoting positive parenting and identifying developmental delays early, something every child deserves. I did best in my time, but I only imagine how different things might have been with more support. Knowing Nevada ranked 43rd in parental care reminds me how far we still have to go. We owe it to the next generation of mothers and children to do better. So I support AB 297. Thank you.
My name is Ambreen Islam, AMBREENISLAM, Chair and members of committee. Thanks for giving me the opportunity to express my strong support for Assembly Bill 297, which establishes a postnatal visitation program for the individuals who have recently given birth. For new mothers, postnatal care is not a luxury. It is a vital form of health care that supports the mother's and newborn's physical, emotional, and psychological well-being. I read a story, The Yellow Wallpaper by Charlotte Gilman, as a teenager. I did not understand that story very much, but when I was going through that postpartum phase in my life after my first child, that story helped me understand my emotional and physical struggles. I did not have any visits, but I was understanding my situation because of I have read something. It is important to understand that women can suffer after giving birth and cannot understand or explain to the people around them because of hesitation or some other reasons or cultural barriers. After childbirth, a woman's body undergoes delivery or C-section, as we know. During this time, mothers face like high risk of postpartum depression and anxiety. Importantly, newborns are in the very delicate stage, and if that caretaker, like mom, is not in the good condition, it can be very problematic. And then from other studies, I'm a PhD student, and I'm a mom of 3, and I'm an educator. So if I read some articles, I do read health articles, and it's a very recent article from Jureva 2025. The postnatal care covering 6 weeks following childbirth is very crucial for the health and the recovery of mothers and newborn. It supports physical healing, mental health, breastfeeding, and infant care and family planning. The problem is that postnatal care is underutilized due to the barriers, like I mentioned before. It can be financial hardship, cultural constraints, or limited access. The studies emphasizes that the need of strengthened healthcare systems, trained personnel, and community-based approaches to ensure timely and quality postnatal services. So I'm going to say this is a very kind and evidence-based policy that reflects our commitment to our maternal and infant health.
Thank you so much for your comments. You are over 2 minutes at this point, so if you will please wrap your comments. Thank you so much.
So I urge you to pass this bill, AB 297. Thank you so much.
Good afternoon. My name is Faiza Ahmed, Faizahmad, and I'm here to express my strong support for AB 297. As you know, mothers are sent home within 24 hours of delivery or a few days after a cesarean section, still in pain, emotionally drained, and expected to care for a newborn without any kind of support. So these visits from the nurse can catch infections, early support breastfeeding, and screen for the postpartum depression, and provide the reassurance during a deeply vulnerable time that the mother is going through. So I would urge you to please pass AB 297 and let's give the family support they deserve when they need it, really the most of the mothers, they need it at that time. Thank you.
Chair Brown May and members of the committee, my name is Matthew Richardson, MATTHEWRICHARDSON, and I am a government affairs manager for Nurse Family Partnership, which is one of the home visiting models provided in Nevada through the Southern Nevada Health District, where we've served families since 2008. Within Nurse Family Partnership, parents facing social and economic barriers are partnered with a specially trained registered nurse, and the nurse begins visiting the family beginning during pregnancy and continuing until the child is 2 years old. The home visitor becomes a trusted resource to empower parents, and we have found from randomized controlled trial research on our model numerous outcomes that benefit families, including a 48% reduction in child abuse and neglect, 56% reduction in ER visits, 50% reduction in language delays, 67% fewer behavioral or intellectual problems, 82% increase in months employed, 61% fewer arrests of the mother, 59% reduction in child arrests, and a 46% increase in father presence, just to name a few. All of these outcomes then lead to societal savings and savings for the state, as we're able to see fewer costs to Medicaid and other services across the state's system of supports. Because aligning the work of home visiting with Medicaid makes so much sense, we're seeing dozens of states across the country amend their Medicaid state plans in various ways to cover home visiting services, which provide numerous case studies and opportunities for lessons learned, such as in the neighboring state of Idaho, where legislation passed in 2020 provided the push to secure federal approval of a state plan amendment and allowed now for models in the state to be reimbursed for home visiting services through Medicaid. And this is opening doors in parts of the state where we're not able to serve otherwise with our voluntary services. Those examples also have brought forward learning such as the importance of including as many of the home visiting models that exist in the state as possible to provide for a variety of approaches to meet the wide variety of family needs, to allow for reimbursement to begin in pregnancy and to continue through the first several years of the child's life in order to give supports and improve outcomes during these critical stages, And also,
Thank you
learning
so
about
much for
how
your
state
comments.
costs-
I'm sorry to cut your comments short. It would be great if you would be able to send that in writing so that we can have a record of that. We are down to our last 1 minute, and I know that we have one more person in queue right now in support. So if we could move on to that one last caller, and then we'll move into opposition. Thank you.
Caller, you are unmuted and may begin.
Hi, my name is Shiza Tahir, Shezatahir. I support AB 297 because it is important for maternal health. AB 297 will prevent maternal mortality through scanning related to depression, anxiety, and suicidal thoughts, encourage positive parenting, and prevent child abuse and neglect, promote child development by scanning to identify developmental delays. AB 297, this kind of health program can make big difference in our state. Thank you for considering this important legislation. Thank you.
Thank you, and thank you for keeping that at 20 minutes exactly. So well done. At this time, we'll move into opposition testimony. If there's anyone here in opposition of Assembly Bill 297, please come forward at this time. Thank you. Same thing, 2 minutes. Please state and spell your name for the record. You may begin when you're ready.
Hi, we'll try to make this faster. Thank you. My name is, good afternoon, Chair Brown May and members of the committee. My name is Katzen Kawitz. It's spelled Sienkiewicz. I am here today representing the Nevada chapter of Stand for Health Freedom, a national grassroots organization with approximately 20,000 Nevadans that follow us and support our advocacy work here in the state. Our main focus is protecting informed consent as related to medical interventions. While the offer of an in-home postnatal visit from a healthcare professional to help new mothers sounds like an offering that I'm sure some women and their families will be thrilled by, the language in this bill concerns us. There's no clear indication that these two, well, now more than two, but that the presumed in-home visits are optional. I would like to propose an amendment to the bill that would make it clear that participation in the program is optional. Please consider adding the words optional to line 3 on page 2 so it reads the program for optional postnatal visitations, and also to line 8 on page 2 change it and add the words so it reads without any charge to the resident who has given birth if the resident opts to receive such visits. The bill sponsor did clearly state that the program is intended to be optional, so please do update the language to the bill to clearly reflect that. If these changes are made, we will be in support of AB 297, as it sounds like a wonderful option for some mothers of newborns who would appreciate the additional support. I hope you'll consider this request to make the amendment. Thank you.
Madam Chair, members of the committee, my name is Janine Hansen. I'm the state president of Nevada Families for Freedom. Earlier in my life, I was an apprentice midwife. In fact, I had the opportunity to deliver my own grandson. He is now 17 and 6'2", doing well. But I understand through this experience, having done all the prenatal and the postnatal care, how important that is. And we don't oppose that, but we are concerned that there is nothing in the bill that shows that it is optional, as Kat mentioned. And also in the bill, when I read it, I didn't see, perhaps I missed it, that it only applied to people on Medicaid, because it says residents in the bill. So that was our original concern. And the other thing that is confusing is that in the original fiscal note, it was $27 million, which makes it appear that it would apply to more than just people on Medicaid. So those were some of our original concerns. I would just state this one thing that as I was doing research, mandating in-home visits instantly transfers nurses from those who do not want them into state agents invading their home, looking around, and imposing unwanted requirements on the parents, that non-compliance with medical advice, and see what happens regarding neglect allegations. there's a lot of concern from people with having somebody they haven't invited into their home with these issues. And I think it's very important to make sure it's optional. I have appreciated the work of Robert F. Kennedy on vaccines. My daughter almost died from a vaccine when she had a femoral seizure and quit breathing. I resuscitated her. And so I think people might have different opinions on significant medical issues. Thank you very much, and please make it optional.
Thank you. Seeing no one else here in opposition in Carson City, we'll move down to Las Vegas. Go ahead, you may begin. Please state and spell your name for the record. You have 2 minutes.
Yes, hello. My name is Erica Neely, and I oppose AB 297. First, I want to say that we have programs now in place available, and if is stating that if they're not being used properly, my concern is why are we expanding the program? And also, I do want to add that all previous speakers just made the program that is currently available. They made it clear that programs are being used and it's working. So again, my concern is why are we expanding the program when current programs are being used and they're working? Second concern is Section 1, Article 3, increasing of funds. My concern there is that it would be reckless and irresponsible to increase the funds there. And then thirdly, I would like to say that the first 2 Assemblywomen that were speaking on behalf of this bill, my concern there is that they said that this was going to be targeting minorities and Hispanics. As a Latina with 6 children, I do want to say that that is saying that we are unable to be responsible for our medical and that we have no idea what we're doing or taking advantage of the programs. So I do want to just make those 3 points. Thank you.
Good morning. My name is Kimberly Johnston Linsday, Linsday, and I'm in opposition of this bill because I feel it's a form of government overreach. As sympathetic as I am towards new moms, which I myself am as well, needing that care in the home when you're trying to get through breastfeeding struggles or just need community around you to get through what it means being a new mom. It does take a community. I don't believe, having been on Medicaid myself for years and years, that this is necessary at all. We have programs in place that are extremely beneficial. My son with Down syndrome, they have Nevada Early Intervention. It has been a wonderful program that helped me when I needed it. And I don't understand why we would have to have, or having a person come into your home, that state mandated reporter, if they don't like something that you're doing. I feel like this just gives way for unintended consequences that we aren't going to want. And the budget for this, I don't care to pay for that when I don't know or agree with half the things that the government says we should be doing. I would prefer to use the programs that excellently work right now and are possibly being underutilized. So thank you for your time.
Thank you for your comments. Seeing no one else in opposition in Las Vegas, no one here in Carson City. AVH, is there anyone in opposition on the telephone line for AB 297?
If you would like to testify in opposition to Assembly Bill 297, please press star 9 or raise hand in your Zoom window now to take your place in the queue. Again, if you would like to testify in opposition to Assembly Bill 297, please press star 9 or raise hand now.
Hi, this is Yolanda Canuck, Yolanda, last name Knaak. First of all, I think that these visits should be only ordered as needed, like for those babies that aren't feeding well or sleeping well or whatever the need is. And second, I don't think they should be mandated. They should be on the discretion of the patient. It almost feels like you're forcing patients to have this. And thank you so much. Bye.
Hello, my name is Katie Banuelos. That's Banuelos. Thank you to the chair and the committee for letting me speak. I want to apologize in advance for any ambient noise on my end. It's a little chaotic where I am, so I apologize. I'm calling in to represent the Libertarian Party. We oppose the bill as currently drafted for many of the reasons expressed earlier. The cost of the bill is a huge concern for taxpayers in Nevada. That's just that's a dramatic increase in what the taxpayers are going to be expected to foot, especially for something that appears to be mandatory. That is our other major concern with this bill. You know, home visits can be wonderful, and many mothers do appreciate that. But there are also plenty of people out there who absolutely don't want to have a nurse or other medical professional sent by the state to show up and knock on their door when they're at home, recovering, spending time with the newest member of their family, and just wanting to be with themselves. That's, you know, unless it is optional and people have specifically opted into this, that becomes a massive invasion of their privacy, personal space. And, you know, like other people have said before, there could be unintended.
It appears we have lost that caller. I'll move on to the next.
Thank you, AVH.
TYRUS HOJJATY. I am calling in opposition. I will ditto the commentators. Thank you so much. Appreciate it. Yield.
Casey Rogers for the record. This is a bill of government overreach, where the government uses the short-term access into homes, evading privacy, which is what this bill is really about. Opening doors for future bills to mandate invading homes in the name of healthcare or in-home visits. No more mandates. Mandates do not equal freedom, liberty, or our right to choose. Further, as mentioned before, this is going to be state-controlled, government overreach. I absolutely disagree with any kind of mandating when it comes to any more healthcare. Your last mandate failed miserably, scientifically and financially. People know how to call 911 or make their way to a hospital if they need care. Oppose AB 297.
Good afternoon. My name is Lynn Chapman, LYNNCHAPMAN, and I'm from the Independent American Party. I'm the state treasurer. Hello, I'm from the government, and I'm here to help you. I think some of us remember those words that it was a joke, but not really. Those are some of the scariest words we can possibly hear. We believe that as long as this is not a mandatory thing, that people can actually opt in to the program, that might be better to put that into the bill and make it clear. When my husband and I moved here over 40 years ago, I was 5 months pregnant. I did go back to California, had our daughter there, and came back to Nevada. And my baby was 2 weeks old. I knew absolutely no one other than my husband. Gee whiz, I read books and articles. I could call my doctor. I could call my mom. I did end up meeting other moms here and there, and that's how I got through. There are people who do need help, and a program like this would be great, but I believe we already have some of those programs available. So if you want to continue with this bill, please put it in the bill that it would not be mandatory, that it is an opt-in process. So thank you very much.
Hello, greetings to the committee. Thank you for the privilege of making a comment. My name is Cynthia Perrine, CYNTHIAPERINE for the record. Whereas I can feel for these vulnerable mothers who may need this wonderful support at the time of their great need taking care of their newborn, I am very concerned, as are others who have expressed opposition, that the bill be clarified to make it absolutely clear that this is an optional program. A surprise visit from a stranger could be very disconcerting. and an unwelcome intrusion to a family's privacy. And no mention has been made really of the costs of this. Also, the registered nurses are in short supply in Nevada, and taking away their skills from people who may really need this might not be wise. So thank you for listening to my comments and making this opportunity possible. Thank you.
My name is Lenny Sue Tinseth, LennySuetinseth. I am a certified professional midwife. I have been serving Northern Nevada and California for 39 years. I understand the value of postpartum home visits. I am opposed to this bill because, first of all, with listening to all of the wonderful testimony today, that you have forgotten to include that really the main support for women is mother-to-mother support, woman-to-woman support, and not necessarily medical support. And that's what most women need postpartumly. This is also a concern about medical providers in the home, as I have nursing students that come through my office for their OB rotation. I have found that many are not culturally sensitive to different lifestyles and families, that there may be use of their position as an authority, a medical authority, to possibly influence parents one way or another against their cultural values. And that has been a concern of mine too for home visits by a medical professional. Again, I oppose this bill. I think that we are eliminating the advantages of the lay people in our communities that are well trained. The doula program was mentioned, which is an awesome program funded by Medicaid. And also we have La Leche groups. We have birthing hubs that have weight stations that are free, breastfeeding counseling that's free. There are so many wonderful resources out there for Northern Nevada and rural California for moms and babies to get the care they need in that 28 days. I also have concerns about the fiscal aspect of this. Asking for government grants through the federal agencies is probably not going to happen, in my opinion. And also that means that would fall on the state, which is a very much of concern when there are other resources that can be of much more great benefit to the families through that kind of community support. Thank you very much.
Thank you for your comments.
Chair, there are no other callers wishing to testify in opposition at this time.
Thank you, AVH. At this time, we'll move into neutral testimony. If anyone here is interested in offering testimony in neutral on Assembly Bill 297, please come forward at this time in Carson City as well as Las Vegas. Go ahead. You may begin when you're ready.
Thank you. For the record, my name is Denise Tanata, DeniseTanata. I'm here representing the Children's Cabinet. I just want to say I'm up in neutral for one small reason. Overall, we support the bill and the intent and purpose. The Children's Cabinet is one of several community-based organizations in the state that does provide home visiting services that are funded under the state McVie program. Our main concern would be under Section 1, subsection 2, just the requirement of having a registered nurse. We actually, of all of the home visiting models, evidence-based home visiting models that we have in our state, only one has registered nurses that do that. Others use community health workers and other home visiting staff. That would also align with the intention under the conceptual amendment to expand for Medicaid to cover these services, because that under Medicaid, the healthcare providers are more expansive than just registered nurses. So I haven't had a chance to talk to the sponsor. We'll do that. We just learned about the bill, but otherwise we support. Thank you.
Thank you. Seeing no one else here in Carson City and neutral and no one in Las Vegas, AVH, is there anyone on the telephone line who would like to offer comments in neutral on this measure?
If you would like to testify in neutral for Assembly Bill 297, please press star 9 or raise hand in your Zoom window now to take your place in the queue. Again, if you would like to testify in neutral for Assembly Bill 297, please press star 9 or raise hand now. Chair, there are no callers wishing to testify in neutral at this time.
Thank you, AVH. This time we'll call the bill sponsor back up if she would like to make closing comments.
Thank you so much, Chair. My name is Hanadi Nadeem. I want to thank everyone for their feedback. And Chair, I would like to address few of the concerns. In the amendments, we have already addressed many concerns, and the intent of the amendment is to make it optional through Medicaid only. With this, I would like to invite Stacey Weeks to please come and explain according to her expertise.
Stacey Weeks for the record, Nevada Medicaid. Yes, the amendment that was hopefully posted online makes this an optional benefit like any benefit in Medicaid, where we can easily add in language in the work session to clarify that it will be an option available to Medicaid beneficiaries only. The registered nurse issue is not in this language, as you can see. It also verifies that DBPH would be the entity that would certify the entities that Medicaid would cover. Also, this is not the government going to someone's house. This is health insurance, which works with healthcare providers. And if a mom and really would like the support and help, the registered nurse or the provider that is qualified and certified DBPH could go and serve that mom, and then Medicaid would pay for that service. So thank you.
Hanadi Nadeem. Respected Chair, Vice Chair, and dear members of the committee, postnatal care is not a luxury. It is a vital form of healthcare that supports the physical, emotional, and psychological well-being of both the mother and the newborn. Beyond physical outcome, the emotional reassurance provided by the postnatal care is deeply meaningful. Postnatal care can be the difference between birthing parent thriving or struggling in silence. AB 297 is a compassionate, evidence-based bill that reflects our commitment to maternal and infant health. By investing in early postnatal visitation, we are not only supporting the well-being of families, but also reducing the long-term health cost associated with preventable complications. I urge all of you to please support AB 297. Thank you.
Thank you. This time we will close the bill hearing on AB 297. Thank you. Next on our agenda is Assembly Bill 101. We will invite our member to the table and officially open the bill hearing for Assembly Bill 101. You may take your time and begin when you're ready. As you begin, Assembly Member, I would just like to point the members, anyone who is participating in this, there is an amendment which completely changes the bill that was originally posted on Nellis. I just want to make sure that people are aware. I believe that is what will be presented today. Is that correct?
That's correct. David Orientlicker. Well, good afternoon. I'm Assembly Member David Orientlicker, representing District 20 on the southeast side of Las Vegas. Thank you very much for the opportunity to present Assembly Bill 101. This bill revises the definitions for deceptive trade practices in NRS Chapter 598 to make sure the Consumer Affairs Unit at the Department of Business and Industry and the Office of the Attorney General have the necessary authority to protect Nevadans from being misled when they're contemplating a purchase of a product or service. And as the chair indicated, I have submitted a conceptual amendment that completely replaces the original bill other than the last section with the effective date. That's still in. But everything else is out. Sections 1 through 13 are gone, and the conceptual amendment adds a new section. Where does this fit in the code? There are a number of sections in NRS 598, that chapter, that define deceptive trade practices. There are more than a dozen sections that identify different ways that businesses or individuals might deceive potential customers. This bill focuses on section 598.0915, to revise that section's definitions of deceptive trade practices. And if you look at the existing language of Section 598.0915, there are 16 definitions for a deceptive trade practice, and they capture many different kinds of deception. For example, under subsection 5, it's unlawful to misrepresent the ingredients of a product. And under subsection 6, it's unlawful to represent a product as new when it's actually secondhand or refurbished. But there are some, despite all that is in section 598.0915, and as I said, there's a lot in there, 16 subsections, there are some gaps. For example, if you look at subsection 15, it is unlawful, quote, to make any other false representation in a transaction, unquote. By applying that section to a transaction, the prohibition doesn't kick in until someone has actually purchased the product or service and therefore may have been harmed before the law applies, right? They didn't get to the transaction, so it doesn't cover. The proposed new subsection in this bill is designed to prevent people from being misled before entering into a transaction for a product or service, and that would be especially important in healthcare. The proposed addition, which is added, I put it as subsection 14, but our learned counsel may find a better place. It would prohibit people from making deceptive statements about their products or services. So, for example, suppose a doctor advertised stem cell treatments for Alzheimer's disease or orthopedic problems. I've picked real examples that have happened. These treatments are still very much experimental and can cause serious harm. If the doctor misled patients about the potential risks and benefits, the doctor would be acting unlawfully under this bill, and we wouldn't have to wait for a patient to undergo the stem cell treatment and be harmed by it before enforcing NRS 598.0915. I've given a healthcare example, partly because of the jurisdiction of this committee, and also because the harms to consumers from deceptive healthcare services are not just financial, but also can be health-related, even life-threatening. So there are examples of people who have gotten injections of stem cells into their eyes to treat eye problems. They've lost sight in their eyes. People have had organ failure. The Pew Charitable Trust in a 2021 report identified 20 deaths from stem cell treatments. In addition, with reductions in the budget and workforce at the U.S. Food and Drug Administration, we may see a significant increase in the number of clinics offering experimental treatments that are too dangerous for patients. Now, while, as I indicated, the bill covers deceptive statements about healthcare services, it's written very generally. It covers deceptive statements from any other good or service, such as home improvement services, cable television services, or anything else that someone might be interested in buying. So that's my presentation. Michael Morton from the Office of Attorney General is here not to testify. The office is neutral, but to help answer any questions because he knows a lot more about deceptive trade practices than I do. So thank you for your time, and I look forward to your questions.
Thank you. Members, are there questions? Okay, Assemblymember Hibbets.
Thank you, Chair, and thank you, Assemblymember, for the presentation. My question is actually not for you, but for our legal counsel. And I'm hoping that we can get on the record how exactly this amendment is germane at all to the original bill.
Thank you, Chair. Excuse me. Thank you, Chair. David Noss, LCB Legal, for the record. So I will start with the joint standing rule that covers amendments. It is Rule 14.7. It states the Legislative Council shall not honor requests for the drafting of an amendment to a bill or resolution if. I will pause there to state that this is ultimately a call of the Legislative Council when the amendment is requested. A conceptual amendment is not a requested amendment, it is a conceptual amendment, so no official determination has been made by the Legislative Council on this matter. To not totally punt the question, I will continue on with what the rest of the amendment, what the rest of the rule says, that if the subject matter of the amendment is independent of and not specifically related and properly connected to the subject that is expressed in the title of the bill or resolution. So when we go to the bill, the title is the paragraph on the first stage that starts an act and then it is indented. So it says an act relating to healthcare, and then the second clause says prohibiting healthcare facilities from making certain deceptive statements to the public. The amendment is still prohibiting healthcare facilities from making certain deceptive statements to the public. It is expanded to now not just include healthcare facilities, but anybody in the section in the course of his or her business or occupation. So it is expanded, but it is still connected to the subject of the bill, and that it is still prohibiting deceptive statements to the public by anybody in their occupation or business, including healthcare facilities. Thank you, Chair.
Thank you, and I appreciate the explanation. I just want to clarify that the original bill, when it brought up the deceptive practices, was under Chapter 597. However, the amendment is under Chapter 598, which is not mentioned anywhere in the original bill. So I just want to make sure that we're still good there, considering we're doing a whole different chapter. Excuse me, sorry.
Thank you, Chair. David Noss, LCB Legal. For the record, again, yes, that is fine. It does not have to be directly related to the same chapter or to the same section. It has to be related to the subject matter of the bill. The rule is general, which is why it is ultimately always the Legislative Council's call. But because the subject matter of the bill is about deceptive statements, and this is still about deceptive statements, I would say it is still germane.
Thank you very much, and thank you for your indulgence, Chair. And Doctor, thank you.
Thank you for the question. Thank you for getting that on the record. Next, we have Assemblymember Goulding.
Thank you, Chair. Thank you for the presentation. What's not addressed in either the original bill or the amendment are penalties for these deceptive practices. How are there any specified penalties?
David Orntlicker for the record. There are. I can't recall off the top of my head, but in that area, that chapter, I think it does specify what the penalties are, and Mr. Morton may recall them.
Welcome to our Phone a Friend. Thank you for joining us.
Of course. For the record, Mike Morton, Special Assistant Attorney General at the Attorney General's Office. The way that Chapter 598 is written is that there is a couple penalty sections that apply to that entire chapter, no matter what the alleged deceptive trade practice or if they're found to have violated the actual deceptive trade practice. Some of those penalties are injunctive relief. That is something that our office does seek for deceptive trade practice to actually end the deceptive trade practice that is currently ongoing. There are also civil penalties based on the number of instances that violation occurred. I believe currently they are up to $5,000, but off the top of my head I do not recall the actual numbers, but it's 598.0995.
Members, are there any other questions? Okay, seeing none, thank you for your presentation. We'll ask you to step back. At this time, we will take testimony in support of Assembly Bill 101. If you are here in support of this measure, please come forward at this time in Carson City and in Las Vegas. Seeing none, AVH, would you go to the telephone lines? Is there anyone here in support of Assembly Bill 101?
If you would like to testify in support of Assembly Bill 101, please press star 9 or raise hand in your Zoom window now to take your place in the queue. Again, if you would like to testify in support of Assembly Bill 101, please press star 9 or raise hand in your Zoom window. Chair, there are no callers wishing to testify in support at this time.
Thank you, AVH. At this time, we will move into opposition. If you are here to offer testimony in opposition of Assembly Bill 101, please come forward at this time, both here in Carson City as well as in Las Vegas. We'll begin here in Carson City. You may begin when you're ready.
Thank you, Chair. Good afternoon, Chair Brown-May and members of the committee. Melissa Clement of Nevada Right to Life, MELISSA-CLE, MENT, in opposition to AB 101. While I thank the bill sponsor for deleting all of the language of the original bill, I am disappointed that this committee will not have the opportunity to hear about the integral role pregnancy resource centers play in communities across our state. Additionally, you will not hear about the hope that abortion pill reversal offers a woman who changes her mind mid-chemical abortion process. Nevada Right to Life remains in opposition to the amended version of AB 101. The language is vague and could be used for nuisance lawsuits or action from the state. Who decides what a person knows or should know about a service that is or is not offered? Given the original bill sought to regulate and intimidate pregnancy centers and shut down abortion pill reversal, I would hope that the new language is not hoping to do the same in a much less transparent way. Thank you to the over 40 people who made work and childcare arrangements to devote an afternoon today to provide 2-minute testimony. I would like to thank the 1,208 Nevadans so far who registered opposition in the legislative poll, and also the 14 who supported it for their participation in the process. On behalf of all the Nevadans who spent time developing testimony and now have an afternoon off, we greatly appreciate the heads up on the complete change of the bill. I would like to extend an invitation to all the members of the committee for a tour of any of the pregnancy resource centers in the state. Just get a hold of me and I can help you tour these great centers. Thank you so much.
Madam Chair, members of the committee, my name is Janine Hansen. I'm the state president of Nevada Families for Freedom. We are very thankful that the original bill is gone. We do have some concerns about the new one. We are concerned with its vague nature, that it's very broad, and we don't know how exactly they plan to use it. We are concerned in particular because of that, because of the intent of the original bill. And thank you very much.
Hello, my name is Isabella Hansen, ISABELLAHANSEN. I'm a 17-year-old Christian. I agree with preventing deceptive practices, but I do not agree with much of the rest of this bill, and I'm quite frustrated by how much this bill covers. I believe that bills should only address a single topic. The addition of this amendment caught many of us by surprise and is confusing. This card shows an ultrasound of a pregnancy and poses the question, is she alive? The answer is a resounding yes. She grows, responds to her environment, and processes nutrients for energy. These are just a few of the qualifications for life that she meets. If a woman takes an abortion pill, she is killing that living person, thus murdering an American citizen and an individual made in the image of God. But there is in fact hope. A woman can save her child using a pill that can reverse the effects of the abortion pill. From there, she can give birth and raise her child or allow somebody else to raise her child as a result of adoption. Abortion pills are easy to come by. They can be given by anyone from a licensed doctor to a pop star. But this bill will make it harder for women to obtain literally life-saving pills. For this reason, it is distinctly anti-life and even anti-choice. Thank you.
Hello, good afternoon. My name is Angela Hansen. I'm here representing myself. You can spell my name ANGELAHANSEN. It's interesting that this is a bill regarding deceptiveness. This last minute change comes across very deceptive. So I'm going to go ahead and speak towards what was originally there, just in case there's any remaining language regarding that. According to Heartbeat International, abortion reversals have saved over 6,000 babies. That's a lot of babies. That's a lot of coerced mothers who came around on their decision. I also wanted to make you aware, if you weren't already, that in New York, the New York Attorney General Letitia James is pursuing legal action against pro-life pregnancy centers to prevent them from sharing truthful information with women about abortion pill reversal treatments. The AG argues that abortion drugs are irreversible, contrary to scientific evidence, and seeks to prohibit these centers from providing information on abortion pill reversal. But this is far from the first time that pregnancy resource centers have been targeted for their pro-life speech, rooted in religious and moral beliefs. It's another attempt on the part of pro-abortionists to silence pregnancy resource centers and prevent them from providing life-affirming support to women and families. I'm quoting an article written by ACLJ. This is, they have submitted an amicus brief. In their arguments, they are pointing out, number one, pregnancy resource centers provide critical services to women and families. They offer a wide array of free services, including medical support, counseling, parenting classes, and essential supplies such as diapers, formula, and baby clothing. These services address both the immediate and long-term needs of women and their families. There are a lot of other concerns, and I know I'm running out of time, so I appreciate you hearing me, and thank you for the important work you do for our state.
Thank you. We'll move down to Las Vegas at this point. And I will just remind you, you just heard the bill presentation. I understand that it was an amendment. I'm going to ask you please to keep your comments in opposition to the measure that was presented today. I think it's really important that we do that to maintain consistency on the record. You do have 2 minutes. Please state and spell your name for the record. You may begin when you're ready.
Hi, my name is Alex Slack. That's Alex Slack, and I am a resident down here in Las Vegas, Nevada. And while I also want to thank you guys that the original bill is now gone, I do also have the same concerns as everybody else that this new BDR, which ironically is under an existing BDR number, has no text or amendments available to the public yet, so it's very difficult for us to be able to participate in this. However, with the presentation given, my question to you guys is, who determines what is deceptive? Who is the author of that? Because how the previous bill and how this new bill comes, it seems this new bill would be a huge umbrella over the previous. The political interpretation of that key word deceptive, which is continuously used, would actually continue to leave pregnancy centers, healthcare providers, and women subject to political persecution. And so with that said, I oppose AB 101 in its previous and in its new content. Thank you.
Good afternoon, members of the committee. My name is Christiane Mersch, last name Mersch. I'm a board member of Nevada Right to Life. We recommend that the bill sponsor amend his bill to protect the public against deceptive legislation practice. We also recommend that the public should have adequate notice about the bills because we were not aware until coming here today. And time and place for bills, hearings, and votes, and access to amendment language. We didn't know that this bill was amendment. We could not access that in the website. We didn't know that would have a totally new language. And this bill does not belong in Health and Human Service Committee. So while we're here, talk about business and sales in this committee. And I also want to highlight as a proud volunteer of our local pregnancy services, that's why I came here today, that they do provide science, not deceptive information, because in an ultrasound, it indeed a scientific technology. When a woman comes to us, we show an ultrasound. We don't show deceptive practice. And that's when she makes the decision to keep her baby because she sees science. 81% of women come to our centers. When they see science, they change their minds. Thank you so much.
Hello, my name is Erica Neely, Neely. As a local volunteer at a pregnancy crisis center, I want to thank you for amending the bill. I also want to tell you that I do agree with Melissa from Nevada Right to Life. My only question to you is the word deceptive. I ask you, according to whom? Thank you for listening. Thank you for amending. Have a good day.
Good afternoon. I'm Kimberly Johnston Linsday. I wanted to say thank you for amending this bill. I still stand in strong opposition to AB 101, and I ditto all the speakers before me. Thank you.
Thank you for your comments. Seeing no one else here in opposition in Carson City and no one else coming forward in Las Vegas, ABH, is there anyone on the telephone line who would like to offer testimony in opposition for Assembly Bill 101?
If you would like to testify in opposition to Assembly Bill 101, please press star 9 now to take your place in the queue. Again, if you would like to testify in opposition to Assembly Bill 101, please press star 9 now.
Hi, Yolanda Kanak, YOLANDAKNAAK. I'm representing myself, of course, and I am calling because I just think that this bill takes away free speech. As far as mentioned that this is a good example. For some people, stem cell therapy didn't work, but I also have talked to some people that had really good results from stem cell therapy. So, I think that it's basically this bill is taking away, as amended, is taking away people's freedom of speech, which is our First Amendment constitutional right. Thank you very much.
BYRUS I am calling in opposition. I will ditto the other commentators. Thank you so much.
Casey Rogers for the record. I'm in lockstep with the first two opposition speakers, Mrs. Clement and Mrs. Hanson, namely. And it couldn't have been said better, and I agree with what they spoke on. I also just want to note that this bill is ambiguous and it leaves questions, and even in its amendment. So therefore, I oppose it, and I ask that you do too. Thank you.
Chair, there are no other callers wishing to testify in opposition at this time.
Thank you, ABH. At this time, we'll move into neutral testimony. If there's anyone here who would like to offer testimony in neutral on Assembly Bill 101, please come forward here in Carson City and in Las Vegas. Seeing no movement in either location. ABH, is there anyone on the telephone line who would like to offer testimony in neutral on Assembly Bill 101?
If you would like to testify in neutral for Assembly Bill 101, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 735, you are now unmuted and may begin.
Hi, this is Danielle Evans, DANIELLE, last name EVANS. I'm not sure what had happened because I had hit star 9 for the opposition line. Could I still offer my testimony in regard to that?
Yes, go ahead.
Okay. I'm a physician born and raised here in Las Vegas, Nevada. I went to Kirk-Kerkorian School of Medicine. I'm invested in this community. I am completing my residency here. I wanted to echo all of the concerns that everyone else brought up regarding both the original bill and then the amendments that are vague, and the concerns about who's defining deceptive practices. And I just wanted to offer my opposition for AB 101 as well, strongly.
Follow with the last three digits, 760. Please press star 6 to unmute your phone. You may begin.
Thank you for the committee for the opportunity to express my opposition to AB 101. This is Cynthia Perrine, Cynthia Perrine, representing myself. I'm concerned that the conceptual agreement, which amends this bill significantly, is not readily available online and it has not been yet reviewed by the Legislative Counsel Bureau. I'm also concerned that this bill prevents deceptive statements, which is rather ambiguous term, before someone uses a product. So that will definitely lead to nuisance lawsuits, which we all do not need. The vague language is problematical as described by everyone above, and thank you so much for letting me record my opposition to AB 101. Thank you.
Good afternoon. My name is Teresa DeGraffenreid, and Theresa DeGraffenreid, DeGraffenreid, and I am neutral on this bill with the changes that have been made. But I am very perplexed with why this bill has been brought forward to the Committee on Health and Human Services. It's strange that everything in this amendment is in NRS already. However, I'm very happy with finally bringing attention and putting on notice Planned Parenthood's long practice of deceptive practices of saying that they offer anything other than abortion, which they do not. They have long claimed that they offer pap smears and breast exams in their offices, when everyone knows that they do not do anything of the sort. This will be good to have them held accountable. Thank you.
Chair, there are no other callers wishing to testify neutral at this time.
Thank you, AVH. We will invite our bill sponsor back up if you would like to make a closing comment.
Thank you, Chair. Thank you, Committee. David Orentlicker. I appreciate your consideration. I just want to assure the people who called in that these kinds of regulations of deceptive trade practices cover well-trod ground, and I'm happy to consider their suggestions for making the language clear to them. Again, thank you very much.
Thank you. At this time, we will close the bill hearing on Assembly Bill 101. That brings us to the last item on our agenda, which is public comment. I will just remind folks in the room, if you are here to make public comment, we will ask you to state and spell your name for the record. You will have 2 minutes. We will not rehear any item that was just heard earlier today, but we are happy to receive public comment on any issue that is germane to this committee. So if you are here to offer public comment, now would be the time. Everyone is welcome here in Carson City or Las Vegas. Seeing no one, ABH, is there anyone on the telephone line who would like to offer public comment at this time?
If you would like to provide public comment, please press star 9 now to take your place in the queue. Again, if you would like to provide public comment, please press star 9 now. Callers, if you have recently joined and would like to provide public comment, please press star 9 to join the queue.
CYRUSHOJJATY. I've been seeing bills all across the country that have been raising certain age requirements to do certain activities from 18 to 21. I'm just curious to know, like, what's the whole goal behind this? What are we going to be looking like? Is 21 going to be the new 18? Is 25 going to be the new 21? Why is this happening? Where is this long-term vision going to look like? Just food for thought. Thank you so much.
Chair, there are no other callers wishing to provide public comment at this time.
Thank you, AVH. Members, that concludes our business for today. Our next meeting is scheduled for Friday. We do have a robust work session on Friday. We will be at call of the chair, so anticipate an earlier time than our normally scheduled time. With that, today we are adjourned.